Medical professionals have read it. Have you ever had a patient so lacking in common sense you wondered how they made it this far? Story 1. I was working an evening relief shift at a pharmacy that wasn't my usual location. The store was quiet when a man walked in, looking visibly distressed. He wasted no time. "I had sexual relations with a woman I do not intend to pursue a long-term relationship with," he announced, enunciating the words like he'd rehearsed them. I blinked, taken aback by the formal phrasing. "Okay," I said carefully, "I'm assuming there was an accident or it was unprotected. How long ago did this happen?" "Last night at 7 p.m., he replied, adding with unnecessary specificity, "on the couch." That was more detail than I needed, but I kept my focus. "We have a medication called Plan B," I began, "and since the incident happened within 72 hours—" "Oh yes," he interrupted. "I got that for her already yesterday, right after we finished. We just want to know if there's anything we can do to tell if she's pregnant now." I shook my head. "Unfortunately, no. She'll have to wait about 3 weeks to see if she gets her period, and if she doesn't, she can take a pregnancy test then. There is a blood test that can give results earlier, but even that would still take at least a couple of weeks." His shoulders slumped. "We're just really anxious. She really doesn't want to be pregnant. Is there anything she can take to prevent it now? Any multivitamin? Minerals? Food?" "She's already taken the Plan B," I explained, "and that's the main option at this stage. There are a few other methods, but they require prescriptions. There's nothing over-the-counter she can take." He paused, then leaned forward. "What about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals?" I stared at him for a long moment. "No, sir," I said finally, "there isn't anything you can take now. Before we continue, do us a quick favor, smash that like button and subscribe to support our channel." Next story. Not me, but my ex-wife works as an endoscopy nurse, and some of the things she sees are unforgettable. Before the procedure, patients have to take a strong laxative so the doctor can get a clear view with the camera. That means drinking 3 to 4 liters of fluid, basically a whole gallon. Some people skip it because they don't like the taste. Others take it but still eat like normal. And some think the doctor just won't notice if their colon isn't empty. Yeah, trust me, with an HD camera, they'll notice. What blows her mind is that patients don't seem to understand why this prep matters. They get a full explanation, printed instructions, and even email links to videos. And honestly, an 8-year-old could follow these steps. And then there was the patient who came in with a pleasure device stuck in his rectum. He didn't need surgery, but they did have to use some tools to get it out. Afterward, he asked for it back because it was his sister's. The answer? Absolutely not. It went straight into what the staff jokingly call the trophy cabinet. Some days in medicine, all you can do is shake your head and laugh. Next story. I work in home health, and at my last job, I got a call from a woman who insisted she was returning my call specifically. The thing was, I had no recollection of her whatsoever. I pulled up our system to check, but there was nothing. No referral, no history, no record that she'd ever been one of our patients. I told her as much. That's when she launched into a full-blown verbal assault. She started yelling, wouldn't let me get a word in, and went on for a solid 8 minutes calling me heartless, an idiot, and a few other colorful names. I wasn't too bothered. The day was slow, and these kinds of calls can be oddly entertaining. Finally, she took a breath, and I tried again. "Ma'am, I'm not sure who called you, especially since we've never heard of you before." She cut me off. "No, it was definitely you. You said your name was Shelaton, and you were calling from Advanced Home Health." And just like that, the mystery was solved. "Ah," I told her, "I see what's going on. You accidentally called Amber Care Home Health. Let me get you Advance's number." Her response? "I have it. They didn't pick up the phone, so I called you guys." That was not the plot twist I was expecting. Next story. Back in my days as a clinical microbiologist, long before computers were a fixture in the lab, I found myself working all over, not just in infectious disease. One afternoon, a young man in his 20s walked in, accompanied by his wife and mother. He was holding a paper request for a semen analysis. It wasn't the most comfortable type of test to discuss, But I was a professional and had done this many times before. The trouble was, no one had explained to him what the test actually entailed. He had no idea how infertility in males was diagnosed. So I took him aside and in clear medical terms explained the procedure and what he needed to do to provide a specimen. His eyes widened with disbelief. He genuinely could not believe I was telling him to masturbate into the collection container. Then came the kicker. He acted as though he didn't even know what that meant. We went through the terminology again. Then again, eventually, I ran through every possible word and euphemism I knew to describe the act. It felt like I was performing a George Carlin routine, minus the laughter. After half an hour of this awkward back and forth, he finally disappeared into the restroom. A while later, he emerged with 2 inches of urine in the cup. The final report? Patient provided improper specimen. Next story. As a pharmacist, I've seen plenty of questionable medication habits, but one woman's routine still sticks with me. She walked in carrying a literal sandwich bag, no labels, no separation, filled with all of her medications mixed together like loose candy. She wanted help figuring out which ones she was running low on and had questions about several of them. At one point, she pointed to a small tablet and confidently said, "This is my blood pressure medicine." I recognized it instantly. It was Oatmeal, a drug for dogs. My concern shot up immediately. Why was a pet medication mixed in with her own? And more importantly, had she been taking it? It turned out she had been tossing her dog's medication right into the same bag as her own, which meant there was no telling what she might have accidentally given the dog or herself. I stressed, in no uncertain terms, the importance of keeping medications in their original containers, not just to protect the pills themselves, but to ensure the correct directions and patient information were always available. Thankfully, I've seen her a few times since, and she's been keeping her meds properly stored. Still, I can't help but wonder how no other pharmacist or doctor had warned her about this before. Next story. As a physiotherapist, I know that after a total knee replacement, there's a critical 6-week window to regain range of motion. If it's not achieved in that time, it's essentially gone for good. I once had a patient, a farmer, who seemed genuinely eager to recover because he needed to be mobile for his work. I saw him about 5 days after surgery, walked him through all the basic exercises, stressed that he needed to avoid farm work for at least 6 weeks, and told him to come see me weekly during that time. Then he disappeared. 8 weeks later, he showed up again. His range of motion was practically non-existent, maybe 30 degrees total. And to my surprise, he was furious. He raised his voice, calling me incompetent, as though his condition was somehow my fault. I started asking questions. Have you been doing the exercises? No. How often are you doing farm work? Every day. Why haven't you come back since your first appointment 8 weeks ago? Too busy with farm work. I summed it up for him. So, you did absolutely nothing I told you to do, and this is somehow my fault? That was the last I ever saw of him. Next story. I'm a social worker, and one of my clients had a long history of repeated pregnancies. She would go through traumatic births, only for her children to be taken into care, and then the cycle would start all over again. One day, I decided to have a frank conversation with her about birth control, about the possibility of using contraception or even getting her tubes tied. I explained how these options could prevent her from going through the same painful experiences again. That's when she told me something that stopped me in my tracks. She said she didn't know that birth control or safe sex could prevent pregnancy because she didn't even understand how pregnancy happened. As a child, she had been sexually abused by her father, who told her she could only get pregnant if she was in love. She had never been in love, so she couldn't understand why she kept getting pregnant. For her, sex had always been about pleasure, never about the risk of conception, and no one had ever told her otherwise. It was one of those moments that reminded me how much misinformation and trauma can shape a person's entire understanding of their own body. Next story. It was around 2 in the morning, and I was working the midnight shift in the ER when a family walked in with their 4-year-old. I asked what was wrong. "Ask him," they said, nodding toward the boy. "He said he needed to see a doctor." I tried again. Did he say anything was wrong? No, they replied. He said he needed to see a doctor, so we brought him. After a brief back and forth, it became clear they had come to the ER at 2 a.m. for no other reason than the child saying he wanted to see a doctor. They had no idea why. I crouched down to the boy's level. Why do you need to see a doctor? He grinned. The doctor has suckers. I just stared at him, speechless. For the record, the kid made perfect sense. It was the parents who didn't. Next story. An 18 or 19-year-old woman came into the ER one day with a complaint that required an X-ray. As part of standard protocol, we perform a urine pregnancy test on any female of childbearing age before imaging. She insisted there was zero chance she could be pregnant. She'd never had sex, she said. We ran the test anyway. It came back positive. Still, she was adamant, so we followed up with a blood pregnancy test to confirm, positive again. We gave her some time alone to process. When I returned, she looked up at me and asked, completely serious, "Can you get pregnant even if your boyfriend didn't go all the way in?" She truly believed that unless the dong was fully inserted, it didn't count as doing it and therefore couldn't lead to pregnancy. It took nearly 30 minutes of patient, careful explanation for her to understand that sperm can travel, regardless of whether it's halfway in or all the way in. Next story. A colleague of mine once treated a man in his 60s who needed a pacemaker for an acute complication. The procedure went smoothly. His recovery was uneventful. He was given clear instructions about his medications, post-op care, and the importance of regular follow-up appointments with his cardiologist and a rhythmologist. He never came back. He never answered the hospital's calls. For 3 years, there was no word from him. Then, one day, he appeared without warning, asking to see the doctor who had implanted his pacemaker. He seemed visibly distressed, so they squeezed him into the schedule. When he entered the exam room, the doctor noticed something odd. The man was wearing a bra under his shirt. It turned out to be his daughter's bra, something he had been wearing for the past 3 months. Why? Because his problem had gotten worse. When he removed his shirt, the reason became horrifyingly clear. The pacemaker, which should have been firmly inside his chest, was dangling outside his body, held in place by the left cup of the bra. Above it, a large, infected, open wound gaped angrily. The pacemaker's leads still threading from the device into his veins and onto his heart. No one knew how he'd survived without dying from sepsis or any number of other complications, let alone how he'd managed to function like this for months. Man gets pacemaker, skips all follow-ups for 3 years, returns with device hanging out of his chest, cradled in his daughter's bra. Next story. I'm a dermatologist in India, where eating with one's hands is common. Our curries and even many dry-side dishes are loaded with turmeric, and anyone who's grown up here knows what that means. Your dominant hand, usually the right, will end up with yellow-stained nails. The stain fades in about a day or so with normal washing. One morning in my OPD, my first patient was a young woman in her early 20s who seemed unusually anxious. I asked what brought her in. "My right-hand fingernails keep turning yellow," she said. "Only your right hand?" I asked. "Yes," she replied, "and only after meals." "Do you eat with your hands?" "Yes, always." I explained gently. "It's just turmeric." She nodded. "Yes, but can you make it stop happening?" "For God's sake, use a spoon," I told her. She stared at me. "So there's no medicine to make it stop?" There was a long pause. "No," I finally said. For anyone in South Asia, or anyone accustomed to turmeric-rich food, this is just part of life. For a grown adult to see it as a medical issue was surprising, to say the least. Next story. I work in veterinary medicine, and I've come to the conclusion that some clients are absolutely convinced they know more than anyone else in the world. Honestly, it's a miracle that pets manage to stay alive at all. People will believe almost anyone over their veterinarian, the breeder, relatives, even the person bagging their groceries. I've seen clients blind their cat with tea tree oil because they read about it online. I've watched them change medication doses for no reason whatsoever. Insulin, in particular, is always fun that way. Some don't follow post-op instructions, resulting in pets eviscerating themselves or ruining a surgically repaired knee. Others feed their dogs pot roast with garlic and onions, insisting it's a bland diet for GI upset. Just last week, a client screamed at me because we didn't give her an exam room with a view. We don't have exam rooms with outside windows. Working in veterinary medicine sometimes feels like a miracle that any of our patients survive. Next story. I work in EMS. One call involved a diabetic man in his 30s or 40s who had refused to take insulin since 2012. By the time I checked him in 2020, his blood sugar was off the charts, so high that the glucometer just read high, meaning over 700. When I pointed it out, he casually asked if that was high and then shrugged it off, blaming all the ice cream he'd eaten. All the while, he was playing a Facebook Messenger video with his girlfriend like nothing was wrong. Later, I ran into him in the hospital parking lot after he was discharged. Less than 50 steps from the ER door, he ripped off his IV bandage and started playing with the wound until it bled again. He knocked on our ambulance door, asking for a bandage. We had to walk him back into the ER and completely rebandage his arm with gauze, hoping that by the time he inevitably removed it, the bleeding would have clotted enough to prevent serious harm. It was a stark reminder that some patients simply don't grasp the severity of their condition or the consequences of ignoring it. Next story. I used to volunteer at a free medical clinic, taking vitals and histories. One day, a woman came in with pneumonia. She wanted to know why her usual treatment, drinking half a bottle of Listerine and smoking a pack of cigarettes a day, wasn't working. I asked her why she thought smoking could help treat a lung infection. She explained quite seriously, "Indians used to purify the ground by burning all the weeds away before planting, so I'm smoking to purify my lungs." At that point, I left it to the doctor. Next story. My wife is an anesthesiologist, and one of the lessons she drills into junior doctors over and over is never to leave drugs unattended in an unsecured area in a hospital, even for a moment. The reason is simple but terrifying. Some people see drugs and think, fun, and take them, even if they have no idea what they are. They might raid a trolley or pick up a syringe off a bedside table. The drugs used for anesthetics aren't just any medications. They're powerful, potentially lethal substances. And yes, in hospitals where she has worked, this has actually happened more than once, with catastrophic consequences. It's a stark reminder that in medicine, even a moment of inattention can be deadly. Next story. I work in veterinary medicine, and many of our patients require ongoing medications to manage chronic conditions like thyroid issues, diabetes, or heart problems. When we start them on the right treatment, they usually show great improvement. But sometimes, at their next recheck, the patient looks awful again. When we ask the owners if they've been giving the medication, the answer is almost always the same. They stopped because the pet seemed all better. Even after thorough education, written instructions, and repeated counseling, some owners still make the same mistake. It's baffling and a constant reminder that pets rely on us to enforce their care, even when their humans think they know better. Next story. Back when I was a vet tech, I had a woman scream at both me and the veterinarian for telling her that rabies vaccination is legally required for her dog. She insisted that the vaccine caused autism in dogs and would make puppies stupid. 3 weeks later, her puppy died of parvovirus. Undeterred, she immediately got another puppy and neglected to properly clean her home. Over the next few months, 2 more of her dogs died. Eventually, animal control and the city had to step in. It was a harsh reminder of how dangerous misinformation can be for pets and their owners. Next story. A patient was firmly instructed that she couldn't miss any fractions of her radiotherapy and to notify the clinic if she couldn't make an appointment. When she found she couldn't attend, she sent her twin sister in her place. The sister answered all the identification questions correctly and even shared the same birthday. The deception was discovered when the radiographers had trouble matching her to the CT scan. The CT was of a patient who had undergone a mastectomy, while the patient in front of them still had both breasts. Years later, this story is still told to new staff during training as a vivid lesson in the importance of proper patient identification. While most people follow the rules, there are always a few who try to game the system, and it only takes one to cause serious problems. Next story. People with massive burns from smoking in bed, surprisingly common, but the one that sticks with me the most, a man came in for chest pain and fatigue. His EKG revealed he was having a severe heart attack. We activated the cath lab for emergency stents to try to save his life. To prep him for the procedure, we needed to shave his groin standard for cath lab access. We explained this, but he refused. No problem, we thought the cath lab could do it under anesthesia. But then he refused to sign the consent for the stents because he didn't want his pubic hair shaved. We tried educating him, pleading, even contacting every hospital lawyer we could. Nothing. Ultimately, he signed himself out AMA and went home. He literally would rather risk dying than have his curlies shaved. Since our hospital wasn't the closest to his home, if he collapsed, he'd likely end up at a different hospital. I seriously doubt he survived the day. Next story, I overheard a conversation in the ER that was equal parts hilarious and sad. A nurse and a doctor were trying to figure out if a patient was seriously injured or just extremely dumb. He kept insisting he was there for a hurt leg, but couldn't explain how it happened, why it hurt, or even how he got there. Every answer was nonsense. I heard the nurse and doctor whispering in the hallway. The nurse was convinced he'd hit his head, and the doctor said, "No, he's just an idiot." Turns out the doctor was right. They called his wife, who quietly explained in the hallway that he's always like this. If left alone, he'd get lost in his own house and probably starve. The leg was visibly injured, but when asked what happened or how it felt, he just gave nonsense answers, not slurred, just completely clueless. "It feels hurt," he said. When the doctor asked if something happened, he replied, "Something always happens, you know how it goes. I was talking to Jimmy and doing our usual work, and my leg hurt." When pressed on what the work was, he just shrugged. "Just, work. I just want my leg fixed." Sometimes you realize the problem isn't the injury, it's the patient. Next story. I used to be a medical oxygen tech, mostly doing in-home visits. And let me tell you, some jobs stick with you forever. This one is a prime example. There was this one patient who needed so much oxygen that if he tried to breathe normal air, he might as well have been inhaling empty space. Keeping him alive required not one, but two heavy-duty oxygen machines working in perfect tandem. Every step of the process was explained to him and his wife, repeatedly, with signatures, documentation, and enough paperwork to wallpaper a small house. And yet, chaos reigned. One machine was too loud, so they'd shut it off. His mask was too cold, so off it came. The hose was in the way, so unplug it. You name it. They did the opposite of what we'd painstakingly explained. Predictably, the moment his oxygen levels plummeted, panic ensued. And who did they call? Me. Always me. I lived less than 5 minutes away from the EMS fire station, yet somehow I was on call for late-night random oxygen emergencies, 3 to 7 days a week. And no, they wouldn't call 911. They didn't want to make a scene. This ridiculous cycle went on for over 18 months, a mix of high drama, poor decision-making, and pure stubbornness. It finally hit the breaking point one night when he tried to sleep and, of course, shut the machines off. Years have passed since then. I still see the wife around town. Every time she shoots me a glare like I'm the one responsible for the disaster she helped orchestrate. Honestly, it's a miracle I didn't start carrying popcorn to their house. Next story. I'm not sure if being a hospital cleaner counts as exciting, but one Saturday morning, I got a crash course in chaos. I arrived early, and no sooner had I clocked in than the ER called for help. My boss sent me over, and I was about to see something I'll never forget. The moment I stepped onto the floor, yelling hit me like a freight train. Behind one of the curtains, a man was shouting at the nurses, "Don't touch my penis," and I didn't use any drugs. Meanwhile, the unmistakable smell of iron blood filled the air. And then I looked down, and up, and everywhere. Handprints smeared across the walls, puddles on the floor. hallways that looked more like a crime scene than a hospital. Almost the entire floor was drenched in blood. The cause? The man had yanked out his own catheter, causing arterial bleeding, and then decided that running away from the nurses was a better plan than letting them help. Somehow, he survived. I don't think I've ever seen that much blood before or since. That day, cleaning didn't feel like a job. It felt like walking into a war zone, armed only with a mop. Next story. I work at a vet clinic, and you quickly learn that some stories are stranger than fiction, especially with diabetic patients. One of the worst I've seen involved an older couple and their massively overweight diabetic dog. They came in saying she'd been slow, tiring easily, and flopping around lately, definitely not her usual self. The doctor checked her blood glucose, and it was so high it was literally off the charts. To put it in perspective, a normal dog's blood sugar is around 100. This dog? Over 1,000. Naturally, we asked how it got that high. Was she eating? Clearly, yes, she was obese. Were they giving her insulin? That's when it got wild. The owners said, and I quote, that they thought she was probably fine without it because she was a strong and hardy dog. Ma'am, your 9-year-old 80-pound Dalmatian is currently half alive on the floor because you won't give her insulin. Somehow, against all odds, this poor dog had survived that long. Watching that little miracle shuffle through life while her owners refused to treat her properly was equal parts horrifying and unbelievable. Next story. I'm an optometrist, and let me tell you, some days feel like you're running a clinic in a parallel universe. Take this one emergency appointment. A patient storms in with a raging red eye, clearly in pain. I check under the microscope. Cornea hazy, wobbly reflexes, general chaos. Me? What happened? Patient, it's my niece's wedding this Saturday, and I wanted my eyelashes to match the color scheme, light blue, so I used hair dye for both my lashes and hair. Me, does that hair dye contain ammonia by any chance? Patient, I think so. Do you think it will be better by Saturday? Will it match the color scheme? Me, unless you can convince them to change the color scheme to red, no. Then there's the patient convinced that healing crystals could replace modern medicine. Gradual vision loss turns out to be cataracts, but surgery? No thanks. I have lapis lazuli at home. 6 weeks later, back they came, ready for the referral. And my personal favorite, the story that made me question my sanity entirely. An elderly patient drove over a bright red and white pop-up tent in broad daylight. Luckily, no one was hurt. But why did they miss a huge tent in the middle of the road? Turns out they'd been driving from memory for the past 3 years. Some days, you don't just examine eyes, you witness the full spectrum of human creativity, stubbornness, and sheer absurdity. Next story. Not me. This one's my sibling's story, but I'm sharing it because honestly, it might just save someone else from a nightmare. Lots of surgeons have tales like this, but this one ends thankfully without tragedy, though it came way too close. So picture this. Parents assured the surgical team that their kid hadn't eaten a thing, following the exact instructions, except they didn't really. They thought the rules were just being unnecessarily cruel. That morning, when their 5-year-old whined about being hungry, they decided, on the way to the surgery center, that a full Southern breakfast was in order. Biscuits and gravy, y'all. Yeah. Long story short, the kid nearly aspirated that breakfast. My brother? I've rarely seen him so simultaneously furious and disgusted. And somehow biscuits and gravy looked even grosser the second time around as he recounted it. Once the child was stabilized, I have zero doubt he laid into those parents like a Category 5 hurricane. And somehow they still felt justified, probably fuming that someone dared tell them what their kid could or couldn't eat. They definitely still thought they were in the right. Not a hint of acknowledgement that they could have very easily killed their own child. They were mostly annoyed at the whining. Honestly, sometimes logic just doesn't stand a chance. Next story. Back when I worked in cancer research and surgery, I saw a pattern that was heartbreaking and sometimes infuriating. Some patients refuse a simple, low-risk procedure because they believe holistic remedies or prayer alone will take care of it. And almost inevitably, they come back later. And by then, the cancer has grown far beyond the easy fix. I remember one case vividly. A patient had a melanoma on their calf. The plan? A straightforward wide excision, a small procedure that could have kept things contained. But they decided to leave, hoping to pray it away. A couple months later, they returned. The melanoma had grown aggressively, and by then, we had no choice but to amputate the leg. Worse, they already had positive lymph nodes, which meant the cancer had spread. It's a stark reminder. Delaying treatment can turn something manageable into something life-altering, and that's not a moral judgment, just a clinical reality. Next story. Working in the ER, you see it all, but some stories just leave you speechless, like this one. A woman was brought in by her sister for pelvic cramps and 3 months of missed periods. Surprise, she's pregnant. Then the sister starts casually spilling that the patient's been seeing the Brazilian construction workers building the condo next door. I try to stay professional and ask if they have any questions, and the patient looks at me dead serious and asks, "Will my baby come out speaking Spanish?" Cue a long, awkward pause. Her sister stares at the ceiling like I've just asked her to solve quantum physics. I finally manage, "No, because they speak Portuguese in Brazil." Relief floods the patient's face, and before I can even finish paperwork, the sister hustles her out of the ER like we just survived a minor natural disaster. Sometimes, medicine is less about science and more about just surviving the absurdity. Next story. A woman rushes her baby into the ER with a rectal temp of 103 Fef. The kid is tacky, miserable, and looks terrible. She refuses all medications, claims she doesn't believe in them, and keeps asking why her jug of herbal tea isn't working. She just wants us to check the baby out, like a pediatric ER is some kind of casual consultation. We try to explain why the child needs an NSAID. She keeps refusing, insisting she doesn't know what's in it. I point out that she delivered her baby in a hospital and received IV medications and an epidural herself, but still, she won't budge. Her only concern seems to be herself. I warn her, when her kid seizes or goes unresponsive and 911 arrives, the paramedics will give the child whatever it needs regardless of her preferences. Only when the doctor threatens to call social services for potential child endangerment does she pay attention. For about 5 seconds, then she leaves against medical advice. And yes, people like this exist, and somehow they breed. Next story. As a pharmacist, you get all sorts, but nothing tests your patience quite like people buying homeopathic remedies for serious conditions. I remember one woman who came in with a prescription from her dentist, strong antibiotics and painkillers for an infection that was threatening her jawbone. I asked if she knew how to take them. She looked at me like I was crazy and said, "Oh, I'm not going to take those. They'll go straight into the garbage. I just need to buy them so my dentist is happy. I'll stick with insert homeopathic nonsense instead. Don't want to poison myself with chemicals." Over the years, I've learned to just shrug and let these Darwin Award candidates do their thing. Arguing never works, but what really gets under my skin is seeing that these people often have kids or pets, and suddenly, that infuriates me. Next story. I was in the hospital just being assessed when I realized the guy in the bed next to me had been hit by a car. He'd been drinking, and his English wasn't great, so every conversation was basically at volume 11. X-rays come back. His back is broken. They start prepping him for transfer, but the receiving ward is too busy, so he's stuck in a bed being told not to move. Nurse turns her back for a second, and he gets up, pulls out his cigarettes, starts heading for the door, and bam, he falls flat on the floor. Not a little stumble. I swear he bounced. For a solid 10 seconds, the entire room staff, patients, visitors, was convinced he'd severed his spine. Then he pops up with a jolly smile. Nurse goes full-on mum mode. "Get back in the bed now." Next story. I work in clinical research at a hospital, mostly with cancer patients who have run out of standard treatment options. For many, clinical trials, basically experimental treatments, are their best shot. People sometimes get nervous about research, but it's highly regulated and way less scary than it sounds. We were going through the consent form with one patient who had a history of drug abuse. We didn't know everything about the new medication, but one thing was crystal clear. Cocaine plus this drug, heart explosion, plain and simple. The patient swore up and down that they were clean and totally wouldn't do cocaine while on the trial. Fast forward 2 weeks, and yes, they relapsed. You can probably guess how that went. Next story. My brother did a rotation in the ER before med school. Paramedics brought in a guy with a lacerated neck. He'd been drunk and fallen into a fish tank, and his equally drunk buddies had called 911. When the paramedics arrived, they realized the guy's friends had put an insanely tight tourniquet around his neck to stop the bleeding. I texted my brother to remind him about it. This was almost 20 years ago, and apparently it was even worse than I remembered. The guy and his buddies had been doing drunk WWE on top of the neck laceration. He had a 2-inch glass shard stuck in his head, completely unaware of it. 4 firefighters had to hold him down as he screamed sexist remarks at the female doctor. When they finally removed the glass, blood shot about 10 feet across the room. At that point, my brother silently noped out of medicine. He went on to attend Berklee College of Music and now lives his best life as a music producer and engineer. No arguing with drunk rednecks about whether or not there's a shard of glass in their head. Next story. I'm a vet. A few years ago, a client brought in his young cat complaining of lethargy. Physically, the cat was mostly fine, just a bit underweight, so I started asking about diet. Me? What do you feed him? Owner, some trendy raw food brand I'd never heard of. Me? How's his appetite? Does he finish his food? Owner. Yep, he always eats everything. Me? How much do you feed him? Owner. Half a cup. Me? Once or twice a day. Owner. Once every 3 or 4 days. Me. Wait, you feed your cat twice a week? Owner. I believe in a more natural feeding approach. Cats in the wild eat like this, according to my research. At that moment, I realized this guy was basically starving his cat based on some National Geographic-inspired fantasy. I had to explain that domestic cats are not tigers, and small wild cats eat 10-20 tiny meals a day. Surprise, surprise, the cat's lethargy and weight improved dramatically once we started feeding him regularly. Next story. Someone actually asked me how you catch a stroke. This was while their partner was on the floor, unable to stand due to left-sided weakness and no power. They thought he could just sleep it off overnight and be fine in the morning. 12 hours later, they finally called the doctor, asking if there was anything that could be given to the person who was now also incontinent. They hadn't even reacted the previous day when his face was drooping on the left side and his speech was slurred. I said, "He's had a stroke." Their response? "Oh, how do you catch one of those?" Next story. I worked in the ED for 10 years, every single day. And every single day, people come in and you just wonder how they've managed to survive this long. One of the worst. A guy came in for STD testing. He was a twin. When asked why, he said his sister apparently just got an STD. Naturally, we had to ask if he had been sexually active with her. He said no, but then added, with complete confidence, "Well, we're twins, so whatever she has, I must have too." After a collective sigh of relief that this wasn't some bizarre Alabama-style scenario, we had the joy of explaining, gently, that that is not how STDs work at all. Next story. Pharmacist here. A couple stories stick out, though I'm sure there are plenty more I've blocked out. First, a woman comes in claiming her medication was making her vomit. She couldn't remember the name. I check her profile, nothing recent, just some antibiotics and antifungals from almost a year ago. I ask if it was over the counter, and she points to Monistat cream. At this point, I'm already blinking hard. I ask how she was using it. She proudly explains that she'd fill the plunger with the cream and shoot it to the back of her throat to swallow it, because putting it directly on her tongue tasted worse. Yes, she had been orally ingesting vaginal cream. Another time, a coworker of mine got served with a lawsuit while I was on shift. A patient had a fall and concussion and claimed it was because her lisinopril dose had been increased from 10 milligrams to 20 milligrams, and she wasn't informed. She sued the pharmacist, the pharmacy, the doctor's office, and the doctor themselves. Early discovery revealed she had been at a rave with a BAC of 0.18 THC and MDMA in her system. The case against the pharmacy, doctor, and office collapsed quickly, leaving her laser-focused on suing the individual pharmacist. Thankfully, the pharmacy system confirmed she had checked "I decline pharmacist consultation" at this time, so the case was eventually dropped. Some days, being a pharmacist is less about pills and more about just surviving human absurdity. Next story. I work as an ophthalmology surgery tech. We had a glaucoma patient in her late 50s who was rapidly losing vision despite 6 months of drop therapy. Her eye pressures were stubbornly in the 30s and 40s. I asked if she'd been using her drops twice daily as prescribed. She insisted she had, no missed doses. Trying to be gentle, I asked her to show me how she used them. That's when things went sideways. She got super offended, demanding, "Do I look like an idiot to you?" I reassured her I just needed to be sure and asked her to demonstrate. She took out the bottle, shook it, good, looked up at the ceiling, good, opened her mouth, and swallowed 2 drops. My jaw nearly hit the floor. My OD had a front row seat and later said it was the dumbest thing he'd ever seen in 25 years. She started crying, claiming we were bullying her. She said the drops burned her eyes, so she figured, why not just swallow them? Eyes, ears, nose, and throat were all connected, right? Wrong. Very, very wrong. We eventually had to place a shunt implant to save what we could, and we managed to preserve about 30% of her visual field. But yes, she was literally going blind while drinking her eye drops. Next story. I'm a medical professional, but some of my best what the hell moments come from my ex-fiancé. Laugh all you want. This relationship was not my proudest moment. At our baby shower for my son, he actually asked if we were going to pick an innie or outie. I stared at him like he was insane. When I didn't answer fast enough, he got louder, repeating the question. I finally shushed him, took him aside, and patiently explained, "We don't get to choose how a belly button looks. It just happens." Then there was the eczema episode. He had really bad flare-ups, went to the doctor, and was told oatmeal baths help. A few days later, I discovered boxes of Quaker Oats maple and brown sugar scattered around. Turns out, he'd been dumping entire boxes, packet by packet, into the tub. When I asked why he smelled like literal sticky sugar, he was furious, insisting he didn't understand why his wounds were festering. I had to explain, flavored oatmeal is not the same as oatmeal for baths. He was annoyed that I expected him to just know better and said he picked maple and brown sugar because he didn't want to smell like strawberries or peaches. Fast forward a few years, our son had occasional eczema. Pediatrician recommended oatmeal baths. Guess what he bought? Yep, maple and brown sugar again. When I started scolding him, he looked at me like I was the idiot and explained he only used 1 packet this time because we were bathing the baby in the sink instead of a full tub. Somehow, that made it perfectly fine in his mind. Next story. Okay, so I'm not a medical professional, but this one really stuck with me. I work in a gym and recently had a client come in for an induction, a full walkthrough, designing a program based on goals, needs, and physical capacity. She's in her late 70s and has a shoulder injury so severe that the physiotherapist told her the rotator cuff is barely attached. She's been living in intense pain for years and hasn't been able to use that shoulder at all. She flat out refuses to see a doctor because she doesn't want surgery. I've reinforced the physiotherapist's warning and have refused to give her any upper body exercises, but she doesn't care. She'd rather live in severe chronic pain than consider the medical treatment that could actually help her. She only takes pain medication when the pain is unbearable, and even then, it's a temporary fix at best. It's one of those situations that's simultaneously frustrating and heartbreaking. She's choosing to suffer because she's too scared to get the care she needs. Next story. As a midwife, I've seen some absolute doozies. At the start of pregnancy, while taking patient histories, I've been told of some truly wild allergies. One patient insisted she was allergic to epinephrine because the one time she had it, it made her heart race. But she couldn't even tell me what the original allergy was that required the epinephrine. Another patient claimed she was allergic to all opiates, dimenhydrinate and diphenhydramine, because they made her sleepy. Then there's the classic panic pages. I've had several patients convinced their water had broken, only for it to turn out they just had intercourse and it was semen. Honestly, I'm not sure how some of these people got pregnant in the first place. And one that really sticks with me, more than one patient has asked if it's even safe to have a bowel movement late in pregnancy, worried it might give the baby an infection. Yikes. Pregnancy is miraculous, but sometimes it feels like I need a PhD in common sense to get through the histories. Next story. This was around 1983. I'm a retired nurse. We had this guy in his early 20s who went swimming drunk in a notoriously nasty local lake, the kind of place everyone warns you not to drink the water from. He was barefoot, stepped on an old beer tab, and cut his foot open. He didn't go to the hospital or even try to clean it for about a week. His girlfriend kept pressing him to get it checked, but he kept saying, "It's fine, it's just a cut." Of course, he ended up in the ER with a foot that had blown up like a balloon. He spent 2.5 months in the hospital. His foot was completely opened up in surgery for debridement and packing. I can honestly say that, after more than 30 years in healthcare, and after dealing with things like bed sores, radiation wounds, and cancer patients for 7 years at that point, this was one of the nastiest jobs I ever had to do. Adding to the challenge, he was obnoxious, abusive, and when the opportunity arose, cruel. Other nurses will know the type. Fortunately, hopefully, less common and less overt these days. I remember a student nurse I was training came running out of the room in tears. She refused to go back in and wouldn't tell us what he had said. Though I can imagine, eventually the foot was cleaned out. He responded well to antibiotics, and the tissue was granulating nicely. He was discharged with strict instructions: keep the foot clean and dry and continue antibiotics. But on the very day he left the hospital, he went back to the same lake, got drunk again, put on his dirty tennis shoes, and went swimming. A week later, he showed up back on our floor. He lost the foot. His girlfriend left him. Next story. I've seen plenty of dumb things in my medical career, but a couple of stories really stand out. One involved an 80-something-year-old woman in the ICU for a heart attack. Because she was acting a little off, they did a tox screen, which came back positive for cocaine. One of our doctors went in to talk to her about it, and she loudly proclaimed, "I only did it because my husband had some." Our doctor told her that probably wasn't a great reason. A little later, her kids and grandkids, all probably in their 20s or older, came to visit. When they figured out what had happened, you could hear them yelling, "Grandma!" I couldn't help but laugh. Grandma, living her best life. Another story goes back to college. We were hanging out in a dorm room smoking weed with a bunch of people when a friend fell and started having a seizure. No history of seizures, so we called 911. The ambulance wanted someone to ride along, so I went. He was post-ictal, still hazy from the seizure, and when the ED staff questioned him, it went like this. ED, so I understand you've consumed some marijuana tonight. Friend, yes, sir. ED, how much? Friend, 20 grams. I completely lost it laughing, and the staff looked utterly confused. Finally, I explained to my friend that they weren't asking about his chores after work. They wanted to know how much he smoked. Once they realized, everyone, including the staff, got a good laugh. Maybe not entirely in line with the dumb patient theme, but that one's still one of my favorite medical stories outside the hospital. Next story. I once went to a 911 call for sunburns at 2 a.m. The man had called at 9 p.m., but appropriately, the call was low priority and got bumped by basically every other call all night. We show up, and I walk in to find this man sitting on the living room floor, looking completely distraught. He explains he has a sunburn on his shoulder from being at a local water park earlier in the day. He says his pain is 2 out of 10. His skin is slightly red on the upper shoulders, no blisters. After what feels like pulling teeth, I finally get that he applied sunscreen once but didn't reapply, saying, "I don't need it," implying his skin tone meant he wouldn't burn. He's done nothing to cool the burn since getting home. All he's done is sit on the floor shirtless, having his wife fetch things for him. At this point, my primary differential diagnosis is man-child who's never had a sunburn, and I feel sorry for his wife. But then she asks if they can apply yogurt to it. I explain aloe vera is better, suggest getting some and keeping it in the fridge, and ask if he wants to go to the hospital. The thing you usually expect when you call 911. He asks how they're going to help, Not if, but how. I explained that the ER probably won't offer anything beyond the Tylenol and Advil I've already suggested, which he refused, and the main recommendation is to rest until it feels better, which I've already said. I also tell him that if he does go to the ER, they'll expect him to wear a shirt in the waiting room. He met the fit-to-sit criteria, so he wouldn't be wasting the charge nurse's time. But still, he ended up staying home. Timing-wise, it worked out perfectly for me. I was working an overtime 3 p.m., still 3 a.m. shift. Next story. I'm not a doctor, but I play one on TV. I worked for 3 months as a secretary in a urological clinic and was regaled with a story about a middle-aged man with a severe perineal and scrotal rash. The guy had tried every cream imaginable. At one point, his PCP prescribed steroids, but it kept getting worse. It was a toss-up between a dermatologist and a urologist, and he could get into the urologist sooner. When he finally came into our office, he took off his drawers and apparently smelled like a wet fart. Turns out, he was barely wiping after bowel movements. The combination of sweat and lingering fecal matter between his buttocks had been worked forward as he walked throughout the day, bathing his perineum and the back of his scrotum in the perfect storm of moisture and bacteria. The result, an out-of-control, blistering, oozing rash. Next story. I once had a college student come in with a corneal ulcer. She had been putting her contacts in and not taking them out for 6 months at a time. She showed up to the clinic, still wearing them, and I basically had to peel the contact off her eye. After removing it, there was a clear compression ring marking where the lens had been. As I walked her out with her prescription for medication and explicit instructions not to wear contacts until I said otherwise, she casually asked, "You threw my contact away. Will you give me one I can wear out tomorrow?" "No, I will not." Next story. A young man was admitted with mild confusion and generally feeling unwell. A&E discovered he had a sore tooth and tried to reassure him, suggesting he see a dentist, but he insisted on an examination. It turned out he had realized that cold water eased his tooth pain, so he drank 11 liters of water in 5 hours. He ended up with dangerously low sodium from water intoxication. Then there was a woman who said she was allergic to rhubarb. I commented on how unusual that was. She explained that she loved rhubarb but had a terrible experience a few years ago. She became violently ill with vomiting and developed a rash for several days. I asked how she had prepared it. She said she chopped both the stems and the leaves and made a crumble. I explained that the leaves are poisonous and that she had likely been poisoned rather than having an allergy. She insisted it must have been an allergy because she felt so unwell she thought she might die, and refused to believe the leaves were toxic. Then there were 2 patients trying to cure their cancer naturally. One ate only organic plant-based food. She had a stage 4 fungating tumor and left behind a 3-year-old son. Having lost my own husband to cancer when my child was that age, it was hard to bite my tongue. The other patient tried to cook the cancer out by heating his home and sleeping by a radiator wearing several coats. He was the only person I've admitted with a high temperature who didn't actually have an infection. The U.S. nurses in states with little to no sex education have the best stories, though. So many immaculate conceptions. Next story. For several years, I worked as a medical technician in a large ophthalmology clinic. One day, a 21-year-old woman came in the moment we opened, frantic and crying that she couldn't see and couldn't open her eye without extreme pain and light sensitivity. It turned out that instead of taking out her daily disposable contacts and replacing them with new ones as directed, she had been stacking a new set on top of the old ones every day for 24 days. By the time she came in, the bottom contact had adhered to her cornea, causing severe erosion and a horrific ulcer. She screamed throughout the exam and kept pushing the doctor away, so she had to be heavily sedated at the neighboring hospital to remove all the contacts. She caused permanent corneal damage and worsened her vision, and it took months to heal. At her final visit, she had the audacity to ask for a contact prescription. The doctor was incredulous and promptly denied the request. Not that she could have worn regular contacts anyway, given the damage to her cornea. We also had a repeat patient who kept putting super glue in her eye. She claimed the dry eye ointment tube was the same shape and insisted she kept mixing them up because for some reason she stored them side by side in her bathroom cabinet. Next story. When I worked as a practice nurse, I got a call from a local council member. Now, most people dislike our town council, but I at least assumed they had to be somewhat competent, though sometimes that clearly isn't the case. He asked for an antibiotic prescription. I asked why he thought he needed antibiotics. He explained that he had gone swimming in the local pool a week ago, pulled a muscle in his neck doing the butterfly stroke, and believed he developed a spinal cord infection the next day, all because his neck was sore. He had no other symptoms at all. I didn't quite know what to say, so I told him he didn't have an infection and didn't need antibiotics. He got annoyed and said, "You can't diagnose that." I replied, "No, I can't diagnose, but I can tell you that if you'd had a spinal cord infection since last week, you'd be very unwell in hospital on IV antibiotics, or dead." I asked if he'd taken any pain relief. He said no, he doesn't like taking pills. He then kept ranting, "I have a spinal cord infection. I need antibiotics." In the end, I said, "Look, come see your GP if you think you need antibiotics. Your doctor has to examine you anyway." He showed up, kicked off again about having to wait 20 minutes to see his GP because he had a spinal cord infection. The GP saw him, confirmed he had pulled his trapezius muscle, and prescribed some Panadol, possibly some amitriptyline too. That was the day I realized our town council sometimes seems to completely lack common sense. Next story. I'm a dental nurse, and one case in particular really sticks out. A mother brought her 3-year-old in for an entrance exam. The child had severe cavities. The reason? The parents didn't brush his teeth, and the mother still nursed him at night. We explained that it would probably do him a lot of good if she stopped night nursing after brushing his teeth. It might have seemed cruel, but it was necessary because the child was essentially untreatable at that point. The parents refused to take him to a clinic for sedation treatment simply because, fast forward a bit, they had another child, now 2 years old. Same problem, same reason. Who would have thought that repeating a behavior that causes problems would, well, cause the same problems again? And once again, the child was untreatable, and the parents still refused specialized care. And don't even get me started on the number of patients who act genuinely shocked when you tell them, yes, you actually need to brush your teeth. Next story. This one's actually about me. A few years ago, after my 3rd bout of food poisoning, blinding pain in the lower right side of my abdomen, and vomiting forest green bile, I finally decided to go to the hospital. The Uber driver was a little freaked out when I told them it was probably an emergency. Haha. When I finally got the internal ultrasound, the tech gasped and had the classic Pikachu face. Turns out my appendix had ruptured 5 months earlier and an abscess had formed, which actually saved my life. The doctors kept asking why I hadn't come in sooner, if the pain from the food poisoning was that bad. Honestly, I had a blast that day. I was treated really well because I wasn't rude or demanding, and I chatted with the staff who couldn't believe how relaxed I was while getting prepped for emergency surgery. Next story. I'm not a medical professional, but my father is a living disaster. He's used a chainsaw while standing on the top of an A-frame ladder, sanded floors in a tiny closed-off room without a mask, and once burned his eyes with bleach fumes in an unventilated space. Protective gear? Forget it. He refuses to wear gloves or goggles for literally anything, including paint stripper in poorly ventilated areas. Broken fingers and wrists. He just lets them heal themselves. Partially numb left leg since he was 20? Never checked. Multiple rotting teeth? Nope, no dentist. Recently broke a finger riding a bike drunk. Massages it daily instead of going to the hospital, which, unsurprisingly, makes it worse. He also ripped up carpet covered in mouse and rat droppings with his bare hands, turned on ceiling fans full blast, and insisted on helping me seal a roof with his massively swollen hand. Vaccines? Never, because they're evil. He's 65, and I could honestly add 20 or 30 more stories, but this gives the gist. Living with my dad is a masterclass in how not to survive adulthood. Thank you for watching. If you enjoyed this video, be sure to give it a thumbs up, subscribe, and hit the bell icon so you never miss an update.